in Hong Kong, we have we don't really have a mental health policy, but we have a mental health work plan. And it's been quite clear that we have stated that recovery-based care is essential for all mental health services. So this is quite clear. And because of this mandate, it has given some impetus for us to develop the peer support services in Hong Kong. And in the training of nurses, especially the community nurses as case managers, they have to undergo training in recovery as well, as part of their training curriculum. I think this has also been extended to other allied health professionals. So at the level of training, I think the newcomers, the new graduates, they have more knowledge and about recovery-based care. In terms of the current situation, I think I would think that we are still at an early stage of recovery-based care. We have peer support workers, but we don't really have a substantial number of peer support workers. And for recovery-based care, I think different psychiatric units are moving at different paces. Some places are moving faster, some places are slower. And I think the staff, especially those who have been working in the field for a long period of time, they are actually more skeptical about recovery-based care because this is not their usual way of doing things. And
still medical.
I think the model, as Alice has mentioned, is still very traditional. And it's still very treatment-based. So I think we still have a lot to go, I would say. Both staff and also peer support workers and even some peer volunteers and service users like Alice, they have been involved in training of staff and also in the training of peer support workers as well.
I think our situation is we are getting to develop, because before the user participation or peer support work concept in Hong Kong is no. Just in these 8 to 9 years, we developed peer support concept and peer support worker in the service. And I think we need to have more to do, to have more recovery base. And I think we need more resources to promote the recovery model in Hong Kong, because it's easy. You just give medication to make the symptoms. But if we promote more recovery base, we need more resources to get to it. So this is difficult because in hospital or in NGO, they have the resource. It's limited resources. How they can promote more recovery, but I see the hope in the service, because there are many peers, they are brave to come out, because compared before, they hide themselves. They don't want to share their recovery story. Now I know we have the human library, so they share their story. It happens many different self-organization or university, they do these human library different places. So things happen, but we need to be patient and to do more. And I always share to my peers, I'm just like a hope agent. So we just deliver the hope to the one who need. And so we all do like this to spread the hope. And there's a group of people to do more empowerment work. So I see the hope in the service, but we still need time and resources to see more big things happen. We need to deliver the hope, because when I we need to share our recovery story, and I think not only mental health problem. I think this is a life. We all have ups and downs, so we need to have the hope to see things can happen, can improve the situation. Because when I can recall when I was so sick, I don't have any motive to do anything. So I think in the message I want to share is we need to keep the hope. Hope is the key factor amongst the other factors in recovery.